everyone, welcome to my live stream. I'm Eloise. I've been a pharmacist for 20 years here in the UK, working for the NHS, and I'm here to answer all your questions on medication and supplements. So if you could place your questions in the chat for me to answer, and then I will work through them, but I've already got a question that has been asked to me via Facebook. And it's about, why do some medicines need dosages done by weight rather than just a set dosage? So I'll go into all the different things that affect dosages of medication. But obviously I'm first going to have to do my disclaimers, so I'm just going to run through those. So the information I provide is just for educational and entertainment purposes only, so contact your own healthcare provider if you do actually need individual advice, and I do try and make sure that I'm up to date with the most evidence-based information, but be aware I am in the UK and there is differences across the world with legislation on which medicines are allowed. So, and then I'll just do my intro so that if you can like, subscribe and do all those YouTubey things to help spread my channel to more people so that I can help more people, I would really appreciate it. Okay. Hello to everybody. I can see the chat's already getting busy. So hello to Mr. Angelab, to Lisa, to Coconut, and to Sam. Great to see you on here again. You seem to be my usual crew, which is great. Laurie's already been on to say she can't make it today. Oh, hiya, Lynn, as well. Yeah, it's great to have the normal crew. Hopefully I can answer some new questions this time and just help you feel better about your knowledge about medicines and supplements and taking them appropriately. So the first question, so why do some medicines need dosages by weight? And this is quite often medicines that are taken in hospital, usually things like chemotherapy, where they calculate the dosages from milligram per kilogram of body weight. This is also very true for children. Children's medicines are usually calculated on milligrams per kilogram of the child's weight. So to calculate a dose of a medication, you need to know two things about the medication. At what dose is the medicine's going to be effective, actually going to produce an action on the body, and also at which level is that medication going to become toxic and cause side effects. Now, if there's a big difference between we only need a tiny bit for to be effective and it's not really toxic, you can take massive doses, then when trying to work out what dose to give to a normal human body shape and size, you can go fairly mid-range with the dosage, and that's it, because you know that there's very little chance of it being toxic, so you can go for the dosage. However, if the difference between where it's effective and when it turns toxic is very, very narrow, you've got to be extremely precise in the dosage that gets given to the patient. And for that to be as effective, you've got to know exactly how much of the drug gets into different parts of the body. And not all drugs go to all the parts of the body. It's not quite like the adverts. You don't get take a pain relief and it goes straight to your head, to where your headache is, or straight to your knee, where your knee is. Fortunately, it doesn't quite happen like that. When you absorb a drug, it has to then go into through your intestines, and then your intestines absorb it into the bloodstream. So for the majority of drugs, you end up with getting what is classed as the blood level of the drug. And so it goes in, and then after sort of half an hour to an hour, you get peak body levels in the blood. And so they can calculate that. And that's usually about the same for the majority of adults. Obviously, children are different, because the blood volume for the majority of adults is about the same. because, it's about, I think it's about 4 to 5 pints of blood, but it's about the same regardless of how much extra muscle you've got, how much extra fat you've got. The actual blood volume's fairly the same, but then it debates on whether the drug then goes into different parts of the body. Which tissues does the drug go into? Does it go into the muscles? Does it go into the cells? And does it go into the fat? So, and depending on the medication, some medication you need to do calculations on the full body weight, taking into account the fat, and some calculations need to be done on lean body weight, because it doesn't actually go into fat tissue, it just stays in the lean mass, the muscle mass. So I'm trying to sort of go through this logically. So you've got the drug comes in, and then it goes to the different parts of the body, but then you've also got counteracting that at the same time as your body's trying to get rid of this drug. Your body's very good at detoxing itself. It has lots of different mechanisms of detoxing itself at anything that you put in, even when it's nutrition that you need, any excess, your body's very good at getting rid of the excess. And then if you take anything else in that's not supposed to be in your body is very good at detoxing and trying to kick it out. One method is metabolism by the liver. So quite often drugs most food, when you absorb it into your bloodstream, that blood goes straight to your liver for your liver to try and get out toxins first. That's usually called first pass metabolism. And if there's a lot of that, and that gets rid of a lot as you're coming in, sometimes you need higher doses of the drug to make sure that you can get past that first pass metabolism, or you have to go in by a different route, such as intravenously, because it's not getting absorbed. And then you've also got your kidneys, and they're very good at anything soluble in your blood system. It excretes that out of your system. And so you've got these two confounding effects, the drug coming in and the drug being pushed out. And for some drugs, if they're excreted very slowly, then they can build up in the system over days. And so then you need to know sort of what somebody's kidney function is. Because if they've got a very low kidney function and they're taking this drug and it's not getting excreted, then it's going to build up to a more toxic level to somebody that's got fully functioning kidneys and it gets excreted. So, the efficiency of somebody's kidneys and liver always need to be taken into account. And that's quite often why when people are on long-term medications, every year you'll be asked to do a blood test for your liver function tests and your kidney function tests. Because although some drugs can affect the function, naturally the function can decline over the years, and we need to be making sure that all your medications, whether the dosage needs lowering. Well, back to the original questions, why do some medicines need dosing by weight? This is quite often when you need to be able to get to that high efficacious level quickly. So you can't just wait for it to build up over days like you would with quite a lot of long-term conditions. So say you've got an infection and you really need to get the antibiotics into your system as quickly as possible. They can calculate the maximum dose given and milligrams per kilogram, knowing that they can give that dose. It's not toxic, but it is the maximum dose to get that straight level straight in there straight away. The main use of the milligrams per kilogram is such like chemotherapy. So chemotherapy, there is a very small gap between the effective dose and the toxic dose, because basically chemo is toxic to the cancer cells. So we're wanting to get to the dose where it's toxic to the cancer cells, but limit the amount of excess that's going to cause damage to the rest of the body. I hope that makes sense. So that's some of the reasons why milligrams per kilogram. And then the obvious one of milligrams per kilogram is children. So children aren't just mini adults. For some drugs, kids can actually metabolize and excrete the drugs much quicker than adults and actually need higher doses. Also, when you are calculating doses on children, you can't just say every 6-year-old is the same. You have some very tiny 6-year-olds and some very large 6-year-olds. And that's not even to do with their eating habits and whether they're skinny or obese. Just the height differences. Kids have different growth spurts at different times, whereas one might have a sudden growth spurt at 3. Another one, it might not be until they're 5 and 6 and they stay the smallest in their class, and then suddenly they grow up later on. Also, babies that were premature are very small, and you need to be very accurate with their levels. So with children, they do sort of calculate milligrams per kilogram for a lot of things. So you'll probably find that sort of paracetamol or acetaminophen, Calpol, ibuprofen, and things that are sold over the counter, they will have ranges. And it must have been about 6 or 7 years ago, they actually altered the ranges, because it used to be sort of 6 months to 3 years, 3 years to 6 years, and they were quite like ranges, and they actually lowered the ranges to make it more accurate, because obviously a 3-year-old and a 6-year-old, there can be quite big differences in their weight. And what you may find is that the doses that are for sale for over the counter are always erring on the side of caution. So they will, for the highest end of the range, they will have picked the smallest child of average of that size and done a dosing that's appropriate for them. So a child who is quite ill, especially sort of children that do have chronic pain and such like, and they go to see the GP and the consultant may actually weigh them and do a more accurate dosing for that individual child to make sure that they're getting the correct amount for them and not just using an age range that's safe for anyone. And sometimes that can end up nearly doubling the dose, which can be of a concern to the parents. But the doctor has taken it and done the calculations on the kilograms of the child, it is much more accurate. So hope that's covered that, but feel free, if any of that needs any extra explanation, put that into the chat. But I'm going to go on because I've already a few good chats started in here. So hello to Scott, Amanda and Natasha. Welcome to the thing. So let's go to Mr. Angel Lab's question. Okay, so there are now supplement bundles in stores, for example, the diabetes pack. How do they pick what's in them, and your opinion of are they worth it? Oh, it's a new marketing point. So sometimes they can be useful, as in you may be recommended a lot of different multivitamins and nutrients, and having it in one tablet rather than others, having to take them all separately, can be convenient for somebody. So in that way, they can be useful. But in the majority of times, I would say it's a marketing ploy, as in they probably do sell the supplements separately, but they've realised that if they can package it all together, they can sell to another set of people. What I would say is, for picking them, is work out with your healthcare professional and with your own research what you actually need for yourself. Write them down, look for them separately, and then look through some of the combination products and see if they tick all the correct boxes. And if it ticks the correct boxes for what you want, go ahead and buy it, but don't just buy it because of what it says. Actually do your research on what you need for yourself, and then obviously check with your healthcare provider. What I do have as a concern with these is when you've got lots of multi-ingredient products, but you're being marketed them for several different things. If somebody has several different issues going along, so say you have somebody going through the menopause who also happens to have diabetes, they might pick up the menopause pack and pick up the diabetes pack and take them both together. But then when they look through the ingredients, there will be a lot of doubling up. And I have done a previous video of can you overdose on vitamin A, of which you can, it's a fat soluble vitamin. and I'm just about to do a video on can you overdose on vitamin D and calcium. And again, there are risks. And if you're taking products with multiple ingredients, and then you take another product with multiple ingredients, you have the risk of that doubling up, and more is not always better. To a certain extent, your body can detox and excrete the excess, but not always. And especially if you have got other things going on and your kidneys and liver are slowing down, then yes, there will be issues. So maybe, but yeah, just make sure that you understand what the ingredients are and whether you need them. Hi, Scott. So are there any skincare dietary supplements that you would recommend? Collagen peptide supplements. Now, I have done this in previous lives before, and so you can always go back and have a look at those. But if you would ask me this about a year ago, I would have been on the side of saying no, that they are just a thing. But there has actually been some evidence out to say that, yes, maybe in certain people. So collagen is just a protein. So collagen is the main protein that is the support network for your body. So it provides the support in tendons and ligaments. It supplies the support network of your muscles around the actual muscle strands. It's the sort of the tendons within your muscle. It also provides the support structure for your skin, and it is a protein. So taking a collagen supplement is taking the correct proteins into your body that your body needs. Now, when it comes to a sort of more sort of diet that's an ultra processed diet, we do seem to be lacking some of what was the collagen. So traditionally, people would take an animal and use all the animal, but nowadays people will take just the good bit of meat, and that's what gets processed. But actually, with the tendons, the bones, the cartilage, the offal, that's actually where all the collagen is, and that doesn't necessarily get used anymore. Whereas previously, you would boil that down, you would make a stew and a broth and then a soup, and yeah, you have like your bovine broth, which contains your collagen, and then also jelly's gelatin is the collagen as well. And that doesn't seem to be as much in people's diets, especially in sort of vegetarian diets. So actually having that protein is good for you, but you can do that from get that protein from your diet sources. So then it comes on to, should you take a collagen supplement? And if you are lacking in protein in your diet, and you are lacking in being able to get the protein in your diet, then a collagen peptide supplement or another protein supplement can help boost that. The problem with saying, do collagen peptide supplements help your skin, is your body doesn't work that way. So you don't absorb the collagen and it goes straight to your skin. It's a massive long protein structure. I think it's about 1,000 amino acids long. So when you consume it, you have to break that down into little peptide sequences of just a couple of a few amino acids. You absorb that, then it goes around your body, and then your body puts it to use where it thinks it needs it. So it may not go to your skin. If your body's not prioritizing that, it may go to your tendons. It may go to other structures in your body. So your body will decide where it goes, but it may go to your skin. And there is some evidence that people who do take collagen supplements do end up feeling that their skin's more supple. There is also the theory that if you ingest broken down bits of collagen and they're floating around your body's system, your immune system looks and goes, oh, there's broken down bits of collagen. Oh, is my skin breaking down a bit? Oh, I better put some more resources into mending the skin. And it sort of then tricks your body into thinking it needs to mend your skin. And there's some theories that works as well. So potentially there may be. I hope that helps. So I have to take blood test twice. Yeah. Oh, yeah. Sodium levels. Sodium levels can be tricky for some people. Some people that can have a tendency to drop. Hyponatremia, and it can be a side effects of some certain medications to keep an eye on. So I'm just thinking. Hello, Mum and Dad. Probably there has been some studies about taking sort of multivitamins, and they generally don't take they don't actually provide that much evidence. The ones that have been done are things like there was studies done for certain multivitamins along with antioxidants, the lutein, for things about trying to prevent age-related macular degeneration, which is an eye condition where you degenerate. And so that was a multi-product supplement one. But there really isn't. And as you will find with the majority of companies that are selling multiple ingredient products, is that they'll only ever cite the evidence of individual products. So they'll say, this is a great product, and you know that vitamin D is needed for strong bones, and you know that your B vitamins are needed for your immune system. And they will quote sort of the known knowledge about individual ingredients, but they never really do an actual study of this product with these multiple ingredients in it. But yeah, with the other ones sort of saying whether they're unnecessary. All I can say is that quite often when I've seen studies done taking a multivitamin, they're quite often used as the placebo arm compared to actual medicines. So you'll see the medicines being taken and the placebo arm being a multivitamin, and that was the case in the big heart protection study for statins. The placebo arm was a multivitamin. I think it was vitamins A, C, and D, and they still showed that that it was the same as placebo. Okay, so if one were to give meds to break a child's fever, 8 to 10, which would be best, ibuprofen or paracetamol? All right, so this is the controversy of whether you treat a fever or not, and then which one out of the two is, yeah. So that's it. I'm just going to go in. How high is a fever that would require meds? So that's what I'm going to actually answer first before I move on to the second part. So the reason that we have a fever is our body's immune system kicking in to fight an infection off. So actually a mild fever is a good thing, because it is your body actually kicking in the immune system to fight the virus and the bacteria. And quite often our body seems to work slightly better and get the immune system, and it provides a less tolerable situation for the virus that we're fighting off. So a mild fever is actually a good thing. However, when the fever starts actually causing issues of feeling far too ill and causing other symptoms, then you need to get on top of it to sort of help you sort of feel better enough. You don't want to be going in. And the thing with children is, if a child has a too high a fever, then they can have what's known as febrile convulsions. And that is a very, very scary situation. I remember once having, I used to help run a contact centre, and the child had developed a fever during it, was that ill, and then actually started convulsing, and we had to call the ambulance. Luckily, the other parent wasn't too far away, and both parents actually sorted out, and they got the child to the hospital. But it's a very scary situation, a febrile convulsion. So a mild fever, if you're only sort of hitting sort of like 38, 39, depending sort of for an older person. But for a very young child or for a fever that's getting above 40, you definitely do need to be treating. So the first line for treating a fever is cooling down. So you don't want a cold bath, but a cool bath. You don't want a cold room, but you do want a cool room, and just sort of one simple layer, maybe one simple blanket, and then cooling down with sort of like a cool flannel and such like. And then which is best, ibuprofen or paracetamol? Ibuprofen, there's probably more chance of people having side effects such as it can trigger asthma in certain people. Paracetamol does seem to have a lot less interactions and a lot less problems. But either are fine as long as the child can tolerate it. And I would say alternate. So for each of them, you can only give 4 doses a day. And really, it can be coming off after that 4 to 6 hours. So although you can only give it 4 times a day, you can end up with a period where you're not actually getting as much relief. So I would say give 1 dose of one of them. And if at the 2 hours it's not provided is enough benefit, I would then give a dose of the second one. But make sure that you keep track of what you've given so that you can alternate between the paracetamol and the ibuprofen up to a maximum of 4 doses of either one throughout the day. So you need, if you are going to be using both, make sure you're very good at tracking what you've given. If you don't think that you can track that well, if you are a very tired mum and you're working off no sleep and you know that you're going to end up with no sleep that night because your child is ill, then stick with one and just tick what you've given so that you know what you've given so you don't risk overdose. So safety, always make sure you don't give more than the 4 doses of either one, but you can actually alternate if you need to. So, yeah, so hopefully that's answered your question. Have we got any more questions? I seem to be on top of the comments this time. I did, so some of you were on when I did my migraine live stream a few weeks ago. I actually have been on a training course for migraine this week, which was extremely useful. And it did actually confirm a lot of what I knew. They did have a very good diagram about how these new gepants that are coming on the market are probably going to be the new triptans, which is quite exciting, except for the fact it is going to be a large cost, and there's going to be a lot of nervousness about initiating a new medicine when we don't actually know what the long-term effects are. But if from looking at the mechanism of action, there should be less side effects than the triptans, so that is a good thing. So, yeah, Natasha, migraines are so common. And it was quite interesting because the consultant said, if you actually end up with a patient turning up complaining of headaches and saying that they have migraines, and you go through the tick list of the migraines, there's a good chance that 98% of the time that is definitely a migraine. There's only a 2% chance that it's not a migraine. And he said the other way around is if the GP dismisses it from being a migraine, there was something like a 70% chance that actually the patient is suffering with the migraines and the GPs were just dismissing it as a tension headache, but it actually was a migraine. So he said basically the patient coming to you and saying, I am having a migraine, if it's got to the point that it's bad enough that they're going to the GP with it, it really is migraines. So always take it seriously. So I was very interesting from the hearing this consultant say that. Okay, so would it be advisable to take migraine meds when having a headache that doesn't match the regular migraine but has lasted over several days? Potentially, yes, because although you maybe have a typical type of migraines do come in different varieties. And if somebody has migraines, they may have different variety migraines. The one thing of concern here is, and I do talk about it on the other one, is there is the chance of medication overuse headaches, and all of the migraine treatment, paracetamol, codeine, which actually isn't really recommended, but your NSAIDs and even your triptans all can cause overuse headaches. So if you find that you needing migraine treatment more than 8 times a month, you should always be going back to your healthcare professional to ask to be on something prophylactic to try and prevent the migraine, to be on regular prevention, so that you don't need 8 times a month. And if at any point, even when the prophylactic dose isn't keeping it below a level of 8 times a month, you need to be going back and getting that increased, including going up to see a neurologist and potentially being on either Botox, the new biological injections, or even this newer agent. So if you use ibuprofen regularly, yes, yeah, so that's it. You can get what's called the overuse headache from ibuprofen. So treating migraines with ibuprofen, if you're having to do that for more than 8 days a month, so I'm going to say not 8 doses, because obviously with the ibuprofen you could be taking 3 or 4 doses in a day, but if you're needing it for more than sort of 8 days a month of regular use of the ibuprofen, you really are at risk of then getting rebound migraines from that overuse. So you need to be trying to see if you can get your preventative medication up. Not really, no. Aura is specific to migraines. So other things such as tension headaches, there is no aura with that. Things like cluster headaches, there's no aura with that. So yeah, so the aura is, and I would always say, as you get the aura, that's when you take the medication, because although there is a chance that you may get an aura and not get the headache, the majority of the time you are going to go down, and the earlier you can get the medication in the system, the more likely it is to get absorbed and be used. Whereas once you get to the point of you've got the nausea and the vomiting, you're not going to be able to absorb the medication, and you've gone past the point of no return. I had one. My very first migraine lasted a week, and I don't really remember the week. So yeah, they can be thing, but I recommend going back and listening to the migraine. I think I spent nearly an hour and 3/4 going through all the different things for treating migraines. And it was nice to sort of listen to this consultant and know the research that I'd done was definitely on the right lines for that video. And the fact that there is now this new agent, unfortunately, it does cost a lot of money. So in the UK, there's every area is talking about the potential finances to the prescribing budget for it, because it'll be replacing like the triptans and all the other medication that we use for it. It's extremely very cost effective. So they're having this new agent that's much more expensive. Is going to be a cost to the prescribing budget, but quality of life, migraine is something that really, really does reduce people's quality of life, and also the economy, because people with chronic migraines quite often can't work because you don't know whether you're going to be on a good day or a bad day. And most employers don't just like you to just turn up when you're on a good day. They need consistency. So being able to provide a better treatment for migraine. And when you look at the newer agents, so the MABs, actually the actual trigger chemical in your body that causes migraines, the actual biologicals actually get hold of that and get rid of that. The new pants that are the new tablet, they actually go in the receptor and stop it being activated. So it stops that chemical actually causing problems. So the real sort of the pharmacology behind it is really interesting. I don't know whether just after my last live last week, I did upload a video on statins. I don't know whether anybody's had a chance to watch that. It didn't seem to get shared around by the YouTube algorithm that well. I don't know whether it's because either people are not interested in taking a statin and therefore haven't watched it, or they're quite happy and understand the statin and are already taking it, so that it may not actually be need for that video. But I put it out there because statins are the number one most prescribed medication by GPs in the country. So that's why I picked it, because I thought it is the most used drug. Yeah, so migraines are all to do with the nerves across the sort of the outside of your brain and the blood supply to your brain. And then obviously seizures are caused by the nerves on the neurons within your brain. So there is definitely going to be a link between them. And there is a link with people with epilepsy having migraines. It was quite interesting. One of the people on the training that we watched did ask, is there a link between migraines and people with neurodiversity? And the consultant says there's not been any evidence of a strong link. However, people with neurodiversity are at much higher risk of having sensory overload and sensory processing issues. And it is that sensory processing and overload that can be a cause and trigger of migraine. So there is definitely a link there. So that was quite interesting. But there's lots of medication. There's lots of different conditions where there is comorbidities of, if you've got one condition, you're more likely to have other similar conditions. Any more questions today? I'm also thinking about whether to do a video on magnesium. Do you think there would be interest in that? I have just shared on my Instagram today. There's a lot of supplement companies that all promote magnesium as the wonder. Well, the wonder, I would say the wonder drug, yeah. But actually, the chances of people actually having low magnesium is very rare. The majority of people do not have a problem with low magnesium. Now, there is a couple of medications that occasionally cause low magnesium levels, and I think proton pump inhibitors, your sort of lansoprazole, pantoprazole, and such like for sort of indigestion and gastric ulcers and such like, do cause can cause a low magnesium. But for the majority of people, they don't have a low magnesium level. Now, the majority of magnesium supplements are usually in detox products. And yes, magnesium can be used as a laxative. And I did talk about that in my my laxatives live. And yeah, magnesium can work as an extremely good laxative. Indigestion remedies, which contain magnesium because it helps magnesium salts that help neutralize the acid in your stomach, they're also known for causing diarrhea. And then they're usually joined with something like calcium that's known to sort of do the opposite, to block you up, so that there's a net no effect. But yeah, magnesium is a laxative, and so it's used in a lot of detox agents. But then there's been a lot of thing about magnesium for sleep, and there really isn't any evidence for magnesium in sleep. And I've been following some allergists and some sleep specialist consultants, and yeah, the evidence for sleep, there really isn't any. Also, the magnesium soaks for baths for losing muscle tension and such like. Magnesium doesn't get absorbed through the skin, so you could sit in a bath of magnesium and you're not going to actually absorb any. It might make your skin feel nice, but it's not actually going to get absorbed through the skin. So so there's many different types of magnesium. So you've got magnesium oxide, which is the one that's probably the one that's used mostly as a laxative, because it's the one that really isn't absorbed into your system. So you can take a higher dose and work as a higher dose as a laxative. It's the citrate and the gluconate that are more readily absorbed into the body. But again, there's no evidence that actually it provides any benefit. Oh yeah, milk and magnesia. Yeah, it tasted awful. Did get rid of the indigestion because it does neutralize the acid in the stomach, but then yes, can cause the runs. So, oh yeah. I accidentally, I have to say, sort of having a product and powders and ending up breathing them in can cause a lot of damage to your lungs. I remember once I was on call, had to go to the pharmacy in the middle of the night to make up a prescription for this child, lots of different medications, and one of them happened to be making up the amoxicillin suspension for them. So I got the bottle of powder, gave it a shake, undid the top, measured out the water, went back to pick up the bottle again, and by reflex I went to shake it again, and I didn't need to because I'd loosened the top, and I had this big plume of amoxicillin powder right there in front of me, breathing it in, and it caused me to cough and splutter and everything. And I am just so grateful that I am not penicillin allergic, because I could have been dead on the floor there in anaphylaxis, and nobody would have found me until the morning, or until the ward had called the next person and said that on-call pharmacist is useless and hasn't fetched the medication up. But yeah, so breathing in the powder of anything like that could be problematic. Magnesium shower scrub. Yeah. It's probably a nice scrub. I don't think it'd do anything for your migraines though, because you're not absorbing it, and there is no evidence for magnesium for migraines. The only supplement, and I did mention this back and in the thing, the only supplement that's actually been found to be useful for migraines is riboflavin, one of the B vitamins. So if you were to take a supplement for migraines, it would be one that contains riboflavin. But no, not magnesium for migraines, and you're not going to absorb anything in a shower scrub. So I would find that the problem with shower scrubs and everything, I find one of my triggers for migraines is scents, so different scents. I can't cope with scented candles and such like. Yeah, milk of amnesia. Yeah, that could be funny. Yeah, propofol. Propofol. It's really thick white infusion liquid that's used as an anesthesia for a lot of general anesthetics. So yeah, milk of, it does look a bit like a milk of amnesia. That would be a good name for propofol. It didn't smell. Oh, that's probably good. As in, if it didn't smell that much, then it probably isn't going to trigger a migraine. But yeah. So I think I've kept up to date with everybody's. So it's been quite nice. So what I would like, so what has worked really good on my previous lives is actually doing it as a special on a specific subject. So I am looking for more subjects for future lives on, areas that I could do, whether it be something on what all the medications are for hypertension or stuff like that. So I have been asked whether I could do some debunking of watching influencers, but I don't know how to do the whole play a video and react to it at the same time and have all that on the computer yet. So I may need to ask DC or one of the better YouTubers how to do that, to teach me how to do that, so I could actually debunk some of the dreadful things that we see on Instagram and TikTok. Vitamin C. Now, I did cover this very briefly in one of my lives a long time ago when I've never done a separate video from it. I did it when there was the article around about a certain influencer giving herself kidney stones from vitamin C. So for the majority of people, you do not need to take a vitamin C supplement. For the majority of people, you're absolutely fine with a standard diet. If you do feel as though you're totally lacking in fruit and vegetables and getting vitamin C, there is no harm in taking a very low dose vitamin C supplement. There's a very, very slight evidence that if you take vitamin C and zinc for the sort of week of having a cold, then you may reduce your symptoms of a cold by a few hours. It's no magic cure, but it may reduce your symptoms of a cold by a few hours because your body is probably needing more vitamin C. Vitamin C is something that's added to a lot of multivitamins because vitamin C is essential for many different things. You'll probably find that collagen supplements all have vitamin C in them because vitamin C is required for the collagen to be made. Yeah, people always swear by, taking double, triple doses. Now, when you're taking double, triple doses of a small sort of like 500 milligram tablet for a week, that's probably not going to cause the majority of people any issues. However, there is no evidence for taking it long term. It doesn't prevent you getting a cold, which is what a lot of people want. And it doesn't have any other major benefits. But there was this one influencer who was trying to take maximum doses of a lot of vitamins, and she was then taking vitamin C by infusion. And you probably have seen these people where you have your IV bag, intravenous bag of multivitamins, which there is absolutely no need for. They are just expensive urine. There's no benefit to having it as an IV infusion into your arm more than taking a multivitamin. You're still going to excrete it exactly the same when it's above and beyond what your body needs. Plus, you run the risk if you're having infusions put in to your body by somebody who's not a fully trained nurse, then you're risking infections, and putting needles in you is not something that you should be doing. And yet you just really don't need it. I would just take drink a pint of water, try and have a good diet and take it. But what happened with this is you can overdose on vitamin C. It is water soluble. You do excrete it. And for the majority of healthy people, you do excrete it. However, at very high levels, because you're excreting it into through your kidneys, you can end up with kidney stones. And these are oxalate kidney stones due to the ascorbic acid creating oxalate kidney stones. So they're not calcium kidney stones, they're an oxalate. And there was a consultant urologist who gave I think it was the New York Times, did an article about this influencer. And yes, she had these kidney stones because of the IV infusions of vitamin C causing oxalate kidney stones. And obviously she was towards the end of life with cancer, so she shouldn't have really been. She was trying to solve it, but actually her body just couldn't cope with trying to excrete that amount. Right, so now this depends on what you count as an immune boosting. So immune boosting doesn't necessarily mean it's a good thing. So you have your immune system, and yes, your immune system helps fight off bacteria and viruses and helps, keep you from infections, and that's great. And if you make sure that you have all your micronutrients and all your vitamins, you can have a good immune system. And there are some medicines, there are some ingredients and supplements that can boost your immune system. And mushrooms is one of them. Shiitake mushrooms have an ingredient in them that can boost the immune system. And if you look back to my live where I did about sort of mushroom supplements and such like, the actual supplements that can be immune boosting can actually therefore also be problematic, because you've probably heard of conditions such as rheumatoid arthritis, Crohn's, ulcerative colitis, psoriasis. These are all actual conditions where your body's immune system is in overdrive, and your own body's immune system is actually damaging its own cells and damaging its own organs. So actually having a supplement that boosts your immune system when you actually have an immune condition, it can actually be detrimental. And they have actually found that people who take these immune boosting mushrooms, if they have things like rheumatoid arthritis and SLE, it can make their immune disorder worse and cause issues. So just thinking immune boosting is not a good terminology, because your immune system isn't a sort of needs to be good. It needs to be at the correct level. So when it comes to just sort of viral infections, it's just keeping a healthy lifestyle as best as you can, and remembering your hygiene, washing your hands, keeping a social distancing from people that are ill. If somebody is ill, encouraging them to stay at home and not go into the workplace or go out shopping. I still thank my boss for giving me a virus in December that has taken me 2 months to get over. Finally, my peak flow has come back up, but yeah. Friend of mine has man flu. I told them not to exceed the stated dose or reduce the time between doses. Very sensible, Sam. Yeah, you've always got to keep to the stated doses. And the other thing to watch out for, paracetamol, or for our American friends, acetaminophen. You've got to be careful about multiple products. So you'll have your Lemsip, which has paracetamol, and depending on which one, whether it's the max strength or anything, you could have your nasal decongestant in there. You could even have a bit of a drowsy antihistamine to help you sleep if it's the nighttime one. You then have your things like the night nurse, which is the same. And people will think, well, I'll take a Lemsip and a night nurse. And if they're containing the same products, you can then end up overdosing, especially when you're feeling unwell and you've got a fever and you don't know what time of day it is. I do say to people, even if you need to just have a tick box, one thing I like to do is quite often, like the paracetamols, they come in little strips of 8. So know that strip of 8 has got to last you a full 24 hours and you can't exceed that. So simple things like that. Some people might even have trackers on their phones to track. There is some medication tracker apps. I'm not as, that doesn't do it for me. I prefer just a visual tick off. Oh. So we're getting on for about an hour, so I'll probably finish at the hour, but I would appreciate all of you if you can like the stream, and then once we come off, if you can leave a comment on whether you enjoyed any of the information, so as to sort of increase the YouTube algorithm. Remember that there is all my previous lives you can go back and watch if you've missed any information off them, and I have got some actual videos as well. I'm starting to do some more sort of deep dive videos. So I did statins last month. I'm doing calcium and vitamin D this month. I've got on my list to do proton pump inhibitors, your PPIs, your azoles, your lansoprazole, pantoprazole, and all the sort of warnings and side effects about that, and when it is appropriate to take it and when it may be best to try and come off it. But if you've got any ideas for future live streams, if you want me to deep dive into a specific topic, or you've got questions and things, just go onto my community page and write comments on any of them. I'm always keeping on top of my comments, or you can send me a direct message either through Instagram. You can send me a direct message on Instagram and I can then look at it then. So, but thank you all for joining me again. I've really enjoyed answering your questions. Hopefully they've provided you with some extra information so that you can look after your own health. And yeah, I'll see you all again. Thank you.